Clinician Emotions After Medical Error and Adverse Events by Dr. Joe Shapiro, in collaboration with the Institute for Professionalism and Ethical Practice.
What I'd like you to do is to think of a time when you were involved in a medical error that caused patient harm. It's a painful thing to ask you to do, but I do think it's important just to take a minute to reflect on that. Now, when I do that exercise, regardless of how many people are in the room, I always stop it pretty quickly after asking for that reflection. And the only reason I am able to stop it so quickly is because everybody I know, most clinicians really, we hold these errors in our minds. Somewhere we think about them, and it's not hard at all to recall them. They usually have had a huge impact on us, even when we haven't thought of them consciously in a while. So the next exercise I'd like you to do is just reflect on what some of your feelings were at the time. So again, gathering from the literature and experience and hearing about my colleagues' experience and my own experience after errors, I think I can group some of the feelings as one is a sense of sadness, just that another human is suffering, and that human would be the patient or the family. Followed on the heels of that can be a very deep sense of shame. And with that, with feeling ashamed, a questioning of our own competence. Exploring shame, which is a very powerful negative emotion, involves really looking at the culture of how we're trained. So if we're enculturated as clinicians to be perfect and be personally invulnerable, then both the absence of perfection, which is what's highlighted by having made a mistake, and then also the strong reactions that we may have and the shame that we may feel is not something that we're prepared for, because we're also not supposed to feel things that strongly when it comes to patient care. Another fear that can be involved after we've harmed another human in the context of making a medical error is fear. And so I think we're afraid of what the patient's and family's reaction will be towards this error. What will they think about us now that we've harmed them? And that's a big fear. We've also been told and know that the culture of shame and blame is absolutely dysfunctional. We know that intellectually. Many good people have written about it. But in our hearts and in our culture, it really hasn't changed universally, and we do tend, as a society, to be a shame and blame culture. If something happens, bad event, in any field, in any profession, we do tend as a society to look for the person whose fault it is and ask that person to pay penance, when we know actually that most things that go wrong are really a matter of shared responsibility. So the fears of patient anger, family anger, litigation, which comes out of our societal need to shame and blame, if you will, the fact that we're a shaming culture and that we don't support each other after our colleagues have made mistakes, leads to this really deep sense of fear, and another condition that is even really more difficult, and that is a sense of isolation. And my colleagues who study neurobiology and psychiatry have shown that being isolated is one of the most stressful conditions for any human. The first responders have framed all these emotions and reactions that we may potentially have after we've harmed a patient as normal reactions to abnormal events. So the reactions, the emotions that we just talked about are normal. What's abnormal are the kinds of things that we do face in healthcare, where patients die, we see colleagues suffering, but mainly in this context when we've had a hand in harming another person who has entrusted his or her care to us. That's the abnormal event. So the hallmark of a program that helps clinicians improve their disclosure and apology has to include helping us manage our emotions, helping us name them to ourselves and regulate them, and also handle them so that the patient and family aren't obligated to deal with our negative emotions.
Reflective exercise. Please post your responses on the comments board for this video so that others may learn from them.